Hi everybody, this is Dr. John Pitts from the Centennial Shows Clinic. Today I'd like to talk about torn ankle ligament. So what is a torn ankle ligament? How can you treat it? What problems can it cause? So I think any of us that have played sports at all have had that ankle sprain where you kind of twist that ankle. You may, if you have a mild injury, you may have a little bit of pain and some swelling. You ice it, maybe take some anti-inflammatory medicines, elevate it, all the typical things. And, most of the time it'll go away. But sometimes you have one that's a little bit more severe, where you're really worried about it and you think, there's a bigger problem going on. So in some cases, you can actually tear one of the ankle ligaments. There are several ankle ligaments, and I'll show on the model what we're talking about. So ligaments, just in general, connect bones to bones. And so they're like strong pieces of rope or duct tape that allow a tiny bit of movement between the bones, but prevent it from moving too much. And so the most common ligaments that get sprained in the ankle are here on our model on the outside. So if this is the front of our foot, this is our main ankle joint. The little bone is on the outside part of our ankle. There's a ligament that attaches this little bone across to this bone here. And there are other ligaments that attach it down here and up here and even in the back here. And these we say are the lateral ankle ligaments. And most commonly, you have what's called an inversion injury where the ankle rolls inwards. So you step on something, somebody's foot, landing off a jump, off a curb, hiking on some uneven terrain, playing basketball, playing soccer, anything, and you twist like this. And it can injure that ligament. So if there's a mild sprain of the ligament, you're probably going to have that mild scenario where pain and swelling and sore for a few days, you're hobbling around, and then after a few weeks, it's probably back to normal. Sometimes you can have a bigger tear where the whole ligament isn't torn, but there are big tears, and it may just get somewhat better, but you still have some problems on and off. And if you never get it looked at, it can persist over years. And then even bigger problems where you tear that ligament completely. And you may wind up in a doctor's office saying, hey, I've had this big injury, I'm worried about it, or tried to do conservative things and can't get it better. And so all these type of ankle injuries partially can heal on their own. But the majority of the time when you have these ankle injuries, especially a few of them, you have persistent instability over years. So, for example, myself, I play a lot of sports. I had tons of ankle sprains when I was younger. And I realized when I was coming out to Colorado, just doing easy hikes, it would be easy for me to twist my ankle, have a little bit of pain and discomfort. It was nothing major, but it was quite annoying. And so I'll tell you what I did to help my ankles out and what we do for our patients. And so the treatment options, first step, if you have a mild ankle sprain, rest, ice, elevate, all those things. The next thing is physical therapy, which can help to strengthen the muscles around the ankle and help what we say neuromuscular control, which is basically just trying to retrain your ankle and brain to talk with each other so it's not so susceptible to getting twisted. And then if those things don't work, traditionally all you had was surgery. So if you had one of those bigger ankle sprains, they would try to surgically reconnect those ligaments, which could potentially be helpful, but also comes with more risk for maybe more ankle stiffness, but can help to make the ankle more stable. But for most of these ankle sprains, which are kind of in the middle, we can help those out with regenerative therapies. So one treatment option is Prolotherapy, which is basically a sugar water solution, which creates a little bit of local tissue inflammation that triggers a healing response, and it works really well to help strengthen ligaments up. Typically, you need 2 to 4 injections spaced out over a few weeks to really get those ligaments to heal up. The next option would be PRP, or platelet-rich plasma. I've had both Prolotherapy and PRP to my ankles, and ever since having that treated, I haven't had any sprains since then. And that was about 5 or 6 years ago. And PRP is our growth factors for my blood platelets, which can help to actually stimulate the cells in the ligaments to repair themselves as well. And then finally, if you have one of those bigger ankle ligament tears, and you don't want to have surgery, stem cells can help to repair those tears. So we've had some success with those bigger tears with stem cells. So you have several options to treat those ankle ligaments. Most of the time you don't need surgery. Very rarely you may. But if you're looking to avoid surgery, you have some mild or moderate ankle sprains that kind of keep coming over and over, you have some chronic ankle pain, you want to get that looked at, and you probably could be a potential candidate for PRP, prolotherapy, or stem cells. And reason why you don't want to let these ankle problems go is because over time, even if it's just mildly annoying and you twist it every so often, what's going to happen is that ankle instability over time is going to make that joint unstable, and it's going to lead to wear and tear. So all this movement when you walk, it's going to stress out the cartilage of the ankle joint, and you're going to develop early arthritis, and we want to try to prevent that. So it's better to be proactive and get these things taken care of sooner rather than later. So if you or anyone you know has problems with ankle ligament tear or ankle instability or chronic ankle sprains, let us know here at the Centennial Schultz Clinic. We specialize in treating these type of problems every day. I've had my ankles treated similar fashion for those ankle ligament tears, and it's been doing great. Thank you. Have a good day.